Hello folks, this is Tom again. I just want to take a minute and go over the new 2014 quotes that we have up and running. We're pretty proud of them. We've been checking them out against a bunch of the numbers. There's still information being released, numbers being double checked, but so far we look like we're pretty good shape on things, and I think you'll find this program very interesting. It does way more. We have about 3 times as many plans on it, and it has a bunch of artificial intelligence in it that will kind of help you out on figuring out where you need to be. But not that we don't want to talk it over with you, but the 751 plans, obviously, you need to narrow them down a little bit. I'm going to show you over here. This is the front page, which you're probably not on, but this is their page all about the new 2014 changes, and there's tons of them. There's a tax subsidy down there that I wouldn't worry about, but all these have, more information associated, talks to you exactly about how the tax penalty is calculated. It goes on, talks about changes for small employers, changes for large employers. There is a ton of information on that thing. But I'm going to get to the heart of it here, the 2014 quotes. So this is what everybody's interested in. This is probably the page you're on. It's got the little video. I'm going to click this big yellow button, and I'm just going to take a fairly simple family, which is a family of 4. I'm going to say that they don't get a tax subsidy. I'm going to say they make about 100. Oh, this program fights me because the recording program interferes on things. But anyway, made $120,000. Leave it at the middle option for now. I can show you what the rest of the stuff is later. Just you can experiment with it. For right now, the middle is a great place to be. We're looking at individual quotes. Let's say this family lives in Denver, and we'll go down here a little bit. Don't forget there's a bunch more going on down here. Let's put in the family. So let's say it's kind of a middle-aged family. Let's say it's a 48-year-old and maybe a gender doesn't matter on this too much. So 36-year-old, and they got a couple kids. Say they got a 12-year-old and a 2-year-old. Kind of a split family there. Anyway, I'll hit the button here, and it's going to come back and it's going to say, oh, they make $120,000. They're at 509% of federal poverty level, which means they do not get a tax subsidy. It shows the census, so this is the census going in. And then if you, let's do this a little bit. So there's going to be a series of plans. There's 15 bronze plans. There's 16 silver plans. I'm going kind of fast here. And there's 8 gold plans. So this is our reduced selection of them, believe it or not. But I'm just going to go over some of the more obvious ones. People always look sometimes at what's the lowest cost plan. So one of the lowest cost plans out there is this Kaiser $5,000 deductible HSA. It would cost $626.58 for the family. There is no tax credit, and the pediatric dental, which is required for children under 19, is included in the plan, which is a nice feature. And pretty much all of these. So we went out of our way to pick plans that included the pediatric dental because there were children under 19. If you didn't have children under 19, it would actually pick slightly different plans. But you can go down here. I'm going to pick this Humana plan for the heck of it. And if you look at the Humana plan, it goes through here a little bit. You can get the details on it. Again, it has the little tooth and the person, so it's an individual plan with dental. It has a $48.50 deductible, a little bit on the high side. 80% coinsurance means you pay 20% after the $48.50 to a max out of pocket of $63.50. Looks like it's got a few doctor's office visit copays, maybe 3 of them for $50 and 3 specialists for $75. That'd be per person. And then after that, it's deductible and coinsurance, and then it excuse me, it's got some labs and X-rays at $300. And so there's details to it, and there's some information on the drug card. All plans pretty much have drug cards in 2014. The doctor directory is something you can click on and figure out the doctors. We can help you with that. There is an SBC plan description. This is our easy pre-apply. It's turned out to be really tough to apply for these plans, so what we've developed is a secure form that you can leave your information on. Then we fill out all the forms for you and just have you check it over and sign it. You can leave your contact information here. So you can also see that it splits out each one of the family members, and that's pretty much what's going on there. I'm going to go back one more to where we were and show you what this group looks like if you're just slightly different Let's see if it find me. Let me see if I can delete that. And it loves to fight me on this. There we go. So let's do something like $65,000. 1, 2, 3. It's the recording program interacts with it and messes it up. So now, same group. Yeah, maybe it's not the same group. Well, shoot. Anyway, let's go back and see if we can read one. You could have just got back one and figured this thing out. I think we had like a 47-year-old and a 38-year-old and a 2-year-old and like a 12-year-old. The children anywhere between 0 and 20 and 20 don't matter. They all get rated the same. I don't know, I can't remember. 15, it will not matter on the rating of this because they're just sees them as children, basically, is the way it rates them. Everybody was non-smoking. Okay, so if you remember before, the first plan I think was around $695 or something like that. Well, this is a silver plan. Let me go back up here to the bronze. So the difference here, if you look at the first plan, it should have been about the same price here. But now you've got a $323 tax credit. You still have to add the pediatric dental, so you end up at $328. So a plan that used to be costing, I think it was almost $700 last time, or $600 last time, now all of a sudden ends up being substantially cheaper because you've got this $323 tax credit. Now you're at 276% federal poverty level. So you're still not quite getting into what's called better. There's something called cost sharing reduction. If you get down below 250% federal poverty level, then you also get better plans. So I'm going to try that. So you can go right here. Let it fight me a little bit. Okay, there we go. I think if I do 55,000, or well, I'll show you an extreme case. So family 4 makes $50,000 a year. And you'll see all kinds of good things will be happening for them. So the first thing you'll notice is, well, it's very strange. You'll notice that their tax credit went down, which is unusual. So they got less of a tax credit. And there's a reason for that. It's real tricky, but will make a little more sense when you come down. It turns out if you make under 250% federal poverty level, the 2 kids that are below 19 have to go on Child Health Plan Plus, or we can maybe work a way around it, but you can't get a tax subsidy for the 2 kids and calculate them in your calculations because they have to go on CHIP Plus, or maybe we can get a full price plan for them on the side. But down here you'll see all of a sudden that your medical premium went down, and that's tricky because it's only for the husband and wife. The kids aren't included. The kids are assumed to have to go to CHIP Plus. It includes pediatric dental, so you don't need to add the dental on there. So all of a sudden you're only paying $138.95, which is a pretty good deal, although this is a fairly high deductible plan. But if you look at the details here on this plan, you'll see that it will explain things a little bit on what's going on. It'll come down here and it'll tell you when you break the kids out. It'll show you that the 2 kids down here actually went on Child Health Plan Plus. It has some details on like the fees. If you click on this, you'll see. Should pull that up. Yeah, might be a little hard to see, but basically $75 to enroll 1 child, and they have pretty low. That's $75 a year. So it's not a bad deal. The doctor network's a little tough, but anyway, that's what's going on with it. I hope this makes some sense to you. Go through, play with it. This calculator has a lot of abilities to look at different scenarios and has a ton of information in it. But we're here to help you. Give us a call. Leave us your information. You can leave us your contact information, and it will save your census when it brings it over to us. If you do the easy pre-apply, we can have everything filled out for you. We probably want to talk to you first, but if you do the easy pre-apply, you can fill that out. That's a secure form, and then we can have all the paperwork ready for you if you actually want to sign up for something. So that's what's going on. Take care and have a good day.